Hey everyone, welcome to the YMyHealth podcast. Um, I am your co host, Melissa Schenkman here. And for this episode, we're going to be talking about something that I think a lot of millennials are talking about these days, which is how do I stay healthy? Using different areas of healthcare, particularly complementary health, is something always of interest. And in particular, today, we're going to be talking about chiropractic care, which I am also a big fan of. And we are so fortunate to have Dr. Holden Stanfill here with us. He is the founder of Stanfill Chiropractic Care and Rehabilitation in Missouri, and he comes to us with a background in cell and molecular biology and his Doctor of Chiropractic degree as well. And almost, what are we, a little bit over 5 years now, I think, of being in practice.
Yep, we'll hit 5 years in December.
Awesome. Awesome. Getting close. Getting close. But yeah, but welcome, Dr. Stanfill.
Thanks for having me, I appreciate it.
So welcome. We're thrilled to have you here and to talk with us about such an important part of our healthcare that I think more people, especially in this under 50 age group, need to know about and can really see the benefits so quickly from as well. To begin, Dr. Stanfield, please kind of tell us a little bit for the YMA Health community anyway. What led you to pursue a career in chiropractic care?
Yeah, so when I was, I guess I was probably 11 or 12 years old, I didn't even know what a chiropractor was, and the first time anyone had ever mentioned it to me was, a cousin of mine,
Mhm.
uh, was dating this guy, and he was going to chiropractic school, and so he said, "It's a good career, enjoying going through school," and so I started looking it up on YouTube, and that's actually where I saw it first was YouTube videos, so that's where
Oh,
I
wow.
first heard about it, and, around the same time, which, around, 11 or 12, my brother was diagnosed with cancer, and so I watched him go through treatment and everything, and one thing that he would always complain about that they didn't seem to have an answer for was muscle and joint pain. So,
Hmm.
he's going chemo, going through radiation, dealing with those things in a lot of different ways, lots of nausea, lots of joint pain, lots of muscle pain, and
Mm.
that's something that people don't really talk about a whole lot.
No,
And they
they don't.
didn't want him the doctors that were overseeing his care didn't want him to get massages for risks of blood clots, um, so on and so forth. So, that got me thinking, what could be out there for people in this situation? It's not gonna be a cure for his disease, but what is out there for this type of pain, like muscle and joint related? And then, I thought back to the conversation I was telling you about with, chiropractors, and so it just that's kinda where I connected the dots, and, my brother ended up passing away, and it just really kinda lit a fire in me to, wanna help people or be in the healthcare field one way or another, and so from then on, I was pretty much dead set on becoming a chiropractor, and from 12 until I became a chiropractor at, I guess, that was 2020, so I was, 24. From 12 to
Wow.
24, I just, like, sat on that track and never really thought about doing anything else, and, went through undergraduate with the mindset of going to chiropractic school and getting accepted, as early as possible, and then, just went straight through, and that led me to starting the practice.
Wow, that's an incredible story, and first of all, I'm so sorry for your loss of your brother, and just I think there's so much power we often say here, to the personal story and having that drive you in what direction you choose in your career and just having such an understanding of what other people are going through. And to your point, we do a lot of work with the cancer community, and there is not a lot of talk about or mention about the joint and muscle pain effects from treatments and how do you remedy those? So that's a very interesting point to point out. Well, again, we're so thrilled to have you here and grateful for all that you do. And I'd love to talk about your practice. I know building any practice is a journey, but it sounds like you've had quite a journey coming from such a young age to getting to this point. Tell us a little bit about your wonderful practice.
Yeah, so I'm 28 now. Like I said, we started the practice in 2021. So, the practice has really only been around for like 4 years, which is
Wow.
gone by really quick. And I can't even thinking back to where we started to where we are now, it's like just night and day difference. But when I
Wow.
graduated, I didn't know exactly what was going to happen. I thought that I was going to be working with another chiropractor that I've been interning with, and things didn't end up working out there. So I was like, I guess I'm going to have to start a practice. What else do I have to lose? And so I started looking at options. I ended up opening my practice in a building with a nurse practitioner in it as well. That was a great experience because I got to see her do a lot of she's very holistic. She did a lot of
Nice.
holistic care for cancer patients or just different chronic conditions that mainstream medicine doesn't really have a answer for.
Mm.
So she did some great work. She helped me get started, and a little bit of a business mentor too. Like if I had some questions about, how do I handle this situation, or how do I handle this, she'd always give me some advice. And so she kind of fed me my first, dozen patients or so. And then we got the ball rolling. Things started to pick up a lot when we started doing social media. So
Mm.
maybe 6 months in, I started making TikToks and different videos and things like that to post online. But when I started doing adjustment videos of me adjusting different patients, I realized that that was what was really popular online and brought a lot of eyes to what I was doing. So we just continued to refine that and make it a big part of what we do. And then, fast forward over the next couple of years, we've gained over 1 million subscribers on YouTube, hundreds of thousands of followers across TikTok and Snapchat, Facebook, all the different platforms. And so what it's done is bring a lot of people to our office from all over the country and the world
Wow.
that have been looking for a chiropractor that does the type of treatment that I do specifically. And there aren't a lot of chiropractors that do the same adjustments that I do the way that I do it. And I'm very proud of that. I'm very proud of the unique treatment that we do, but also just the unique culture that we've built. And, we pride ourselves a lot on the experience that the patients have when they come
Mm.
in the office. And, why would I want to be like every other chiropractor down the street anyway, right? Or
Exactly.
anybody for that instance. We try to bring something unique to the table and meet our patients where they're at and what they need. And social media has been a really, really big billboard for that so that people can find
Wow.
us. Because at the end of the day, I always say this, it doesn't matter how good of a doctor you are, a provider, if nobody knows where you're at or what you do, you're not really doing anybody any favors. So you really have to get your name out there and let everybody know, hey, this is what I do and this is what I specialize in so that those people can find you.
Absolutely. That's absolutely true. And I first of all want to congratulate you on the number because that is no easy feat. The number of subscribers on YouTube over 1 million. We know that is very hard to hit. And the number I think you're almost or close to 500,000, I think, on TikTok. I mean, that's just incredible. And right now to your point, uh, in terms of public health, it's all about meeting people where they're at, just in general in public health, and you really are because that's where people are at are on social media, very much so, and that's even how we found you
Yeah,
as
exactly.
well as well, which we were so excited, and so I think that that's wonderful, and it also brings kind of a visual to what chiropractic care is, for people to see who are not as familiar with it as well, and so, I think that's absolutely wonderful, and speaking of which, for those who aren't as familiar, who are listening and kind of they've either heard the term or now they're hearing about it for the first time on today's episode, kind of what's the philosophy kind of behind chiropractic care? How does it work? And how would you say it's beneficial in different ways for your health?
So chiropractic is like the Wild West is how I describe it to people. You have chiropractors that do everything under the sun, and there's a lot of infighting in the profession too. I think a
Interesting.
lot of professions are like this, but chiropractic is one where everybody is fighting over what direction the profession needs to go in. So this will be my definition of what a chiropractor is, or at least in my mind. But I
Yeah,
think chiropractors at the core are muscle and joint experts. That's where our bread and butter is for sure. So if you have any type of muscle condition, any type of joint condition, a chiropractor should be a fantastic starting point for you. Someone that could definitely help you or get you in the right direction, but most 99% of the time would be able to help you with what you're having issues with. And on top of that, a chiropractor is a great holistic provider.
yeah,
So, I love to talk to my patients about diet, exercise, just overall anything to how can you feel better? Your
yeah.
mental health, mental, physical, emotional, um, meditation, hydration, proactive healthcare for sure. How can we limit the amount of drugs or surgeries that you're going to need in your lifetime, and how can we keep you feeling good so that you don't have to need these things down the road? I think that's where chiropractors really shine, or can shine, is in that area, because that's a huge missing sector. Again, in
Yes.
typical primary care, you're only going
Right.
in when you have a problem, and it may be a really severe problem, and sometimes they don't have answers even then. But especially when you're saying, I don't feel too bad, maybe my energy's a little low, or maybe my stomach hurts after I eat, or things like
Mhm.
that, where maybe they think nothing of it. But how can you feel optimal? How can you feel your best? How can you be in the best possible state of health? I think that's where
Yeah.
the holistic mindset is, and trying to just, yeah, keep people optimal.
No, absolutely, which is so wonderful and something so many of us are seeking, honestly, and especially we've heard from people in our community about that. And when it comes, because we have these big terms of, complementary health, and people talk about, let's engage in yoga and let's engage in all, because there's so many different pieces. If you could kind of help put into context how chiropractic care differs from, say, going and getting massage therapy, which I realize is something you offer at the practice, but when you're thinking about the body long term and maintaining that overall health.
Yeah. So, I mean, I would look at it as a chiropractor as a portal of entry. So that means that you can come see me. You don't need a referral or anything like that. But I'm going to be able to point you in the direction as a medical expert and as a doctor to get you a proper diagnosis and get you the right treatment. Massage therapy and massage therapists are great, but they're kind of like a tool on the tool belt, right? So,
Yeah.
um, I would say we have massage in the practice because when I'm treating a patient,
Mm.
if I feel like they need specific muscle work or soft tissue work, I'm going to send them to the massage therapist. But
Mhm.
our training is to prepare us to be medical experts and primary providers. So making sure that we get a proper diagnosis, and we're doing a lot more than just focusing. That's where it ties into, it's not just the muscle work, it's not just the joint work. It really is looking at the patient as a whole and
Mhm.
addressing any type of healthcare needs that they need, whether I'm the one providing that or I'm sending them to another provider to get that as well. Like, for instance, if you go to your primary care and you hurt your ankle, they're going to send you to get an x-ray, but they're not going to be the one to fix your ankle. They're going to send you to an orthopedist who's going to
Right.
perform surgery, and then they're going to send you to a physical therapist to do the rehab, and hopefully a chiropractor too, to do some of the joint mobilization as well. So it in the same way we can do that, but from a holistic perspective. So we're going to send you to where you need to be, or give you the correct information for anything related to your health. But it all starts with, again, you got to come in first. Let's
Yeah.
figure out where you're at. What are your goals? What do we need to achieve? And then we can branch off from there.
That's very, very helpful to hear, an excellent explanation there. And when it comes to those of us in our 20s, 30s, and 40s, tell us, what are people most commonly seeking your help for these days?
So the 20 to 40 age range, there's a couple things we need to consider.
Or
What does their day to day look like? So we've got like two main groups of people, I would say, that we see in our office. It's the laborers and the desk workers, right? So
Oh,
those
yeah.
two people are dealing with very different issues. The desk workers, those people have a lot of neck and upper back pain, chronic headaches, very sedentary lifestyle. They're not moving nearly as much. Uh, they may have more metabolic conditions that need to be addressed. Whereas the laborers, very hard on their body, working their joints to a pulp. Uh,
Yes.
those people injure their lower backs a lot. You're kind of looking at them a little bit differently. But I would say the three most common conditions outright in that age range would be lower back pain with the disc herniation. So we see a lot of lower back disc issues. That's number one, or just low back pain in general. Number
Yeah.
two would be neck pain, uh, accompanied with headaches. Again, a lot of this comes from desk workers. So, if you're sitting at a desk all day, I can guarantee you that you're going to have neck, upper back pain, or tension headaches at some point. It's going to happen.
Yes.
It's almost a guarantee. So, and there's a lot of things that people can do to help with that as well. But yeah, I would say those are the things that 20 to 40-year-old age range is dealing with the most.
Well, I will say, and I'm keep nodding my head because as you're describing the group of the desk workers, I'm thinking to myself, not only have I experienced everything you're talking about, but I know so many people who have all of those things. So it's very interesting to hear that. And and one of the greatest challenges for us in coming to take care of these things, honestly, for millennials is that it's so hard to make time, right? And we know how important it is to make time for health, but our time is so limited. So some people, you know, a lot of us, I've fallen into this at times too, honestly, and I'm sure other listeners will relate. We'll go in and pursue care when we're hurt, when we're injured, but instead of like the maintaining our health. But tell us kind of what does that reactive, what we would call reactive care, look like in the context of chiropractic care?
I would say that the number one time new patients come through the door is when they're in pain. So
Mm.
nothing will encourage someone to seek out help as pain will, because it's always there and it's a constant reminder that you need to do something about your problem. So typically, when I see people for the first time, they're at their worst and they're hurting really bad and they just want me to help them and fix it. So that's pretty much what the first initial meeting is with the patient is, hey, I've got X going on and I need you to fix it. So that's what we work on first is, okay, let's get you out of pain.
Yeah.
But after we get you out of pain, then the discussion changes a lot is, okay, what are your goals here? Would you like to be able to move better? Are you a golfer? Are you a runner? What is it that's preventing you from doing your activity? If it's this pain, let's get the pain under control.
Mhm.
If it's, yeah, I'm tight through my hips, well, maybe we address that too. Or,
Mhm.
I've got these constant headaches and I can't think straight and it's, causing me to disrupt my work. That's something we need to address too. So setting goals is really important,
Mhm.
so that we can transition them from that reactive state to a more proactive state where now we're getting in front of it and we can
Yeah.
start to prevent this from happening in the future. And that's kind of all a part of the same process when we get the patient. We want them to understand the benefit of, here's what's giving you an issue now, but here's how we can prevent it from happening in the future too.
Oh, absolutely. And that's so important and really kind of flows into my next question too. What are the pluses and minuses, would you say, of reactive care that that we should keep in mind as we're making those choices and seeing our, our limited time but
Yeah, I don't know if there's many pros to reactive care other than, yeah, I don't know. But the cons would be that obviously you're gonna be in the highest level of pain.
yeah.
Uh, Typically, when you seek care, you're gonna be in treatment for longer, and you're not gonna be able to do the things that you love doing. And you're kind of always behind the eight ball in the way that you're always chasing pain with something that's, if you only seek care when something's giving you trouble, then you're never really going to see the maximum benefit out of what you're doing. So, for instance, if our goal is to get you more mobile through your hips, really get your headaches under control, but you're only going through treatment enough to get out of pain, then you're never going to be at your absolute best. You're basically getting the pain under control, which is like the alarms going off. So like your body's saying like, "Hey, you really need to pay attention to this. This is an absolute necessity right now." You're getting the alarms turned off, but the fire is not completely out. So, you still need to give this attention
Yeah,
until we see some improvement in your overall activities of daily living. Like, okay, are you able to return to running? Are you able to return to golfing? Are you able to get through your workday without having, some stiffness in your mid back or your lower back? I mean, and that's something that as they go through treatment, it's my job to do a good job explaining that
mhm,
so that they see that, hey, you're greatly less likely of having this problem in the future if we just do some treatment in between. It doesn't have to be as frequent as it is in the beginning. That's another con too, is you're going to have to come in a lot more often when you're in pain to get out of pain than you would if you're on a consistent treatment plan. And that doesn't mean that you're coming in every week, twice a week, or anything like that.
true. No, that's extremely helpful to know, and before and excellent points, and before we go into the preventative care side of things more, just curious in terms of 2 of the, I'd say, main things that I know I talk with a lot of people about, um, how, just out of curiosity, how chiropractic care would help with that is when you have the muscle strain from daily jobs or you've had a sports injury. And I know there are a gazillion sports injuries, so just very general,
Yeah.
uh, basic, you've had one of these things happen, you're gonna go in to for chiropractic care. How can that help with those?
So there's there's the chiropractic adjustment itself, but I also want to emphasize how important it is for the guidance for the chiropractor to
Mhm.
give you advice on things that you can do outside of the office as well. Because so much of what desk workers deal with are things that are habits that need to be changed and addressed. And a lot of that's just education. So a lot of what I talk to desk workers about is varying your posture. So basically switching
Sure.
up your posture throughout the day or getting movement breaks throughout the day. um, Things like that, making sure that you're not sitting at your desk 8 hours a day, that you're ergonomically positioned correctly. So much of that plays a really, really big role. On the chiropractic side of things, the chiropractic adjustment in itself is great for mobilizing you through your spine or a joint segment. So if you're sitting all day, over time, your mid back, let's say, is going to slowly start to tighten up and restrict. And as those restrictions develop and it gets tighter, you're going to have less range of motion through your mid back. So when you come in and you get adjusted, we improve range of motion through each spinal segment in your mid back. And as your range of motion continues to improve, you're going to have less achiness or pain while you're sitting doing your work. Because at the end of the day, joints like movement. And when they're stiff and restricted, that's when they become achy and painful. So we need to keep the joints moving at the end of the day, whether it's, with the adjustment or in combination with adjustment plus exercise plus movement breaks plus postural exercises and good education on all of those things collectively. But it is all like it's all a piece of the pie. And
Mhm.
so you want to make sure that you're doing as much of this together if you want to get real results from it.
No, that makes absolute sense.
Yeah, and one more thing I'll add is a lot of
Yeah.
the time people will say, "Hey, like I've been getting adjustments, but no matter how many times I get adjusted, my mid back is still sore at the end of the day." And that's
Mhm,
true because no matter what I do, or even if you exercise every morning for 2 hours, if
mhm,
you're sitting for 8 hours a day, the muscles cannot withstand that amount of load for that
mhm,
long period, no matter what. So if we're not educating and handling that properly, then everything else that we do will only help, but it will never
mhm.
fix the problem. So in order to completely fix the problem and resolve the problem, we have to make sure that we're addressing everything that you're doing outside the office too.
That's extremely helpful because I know that affects so many people, myself included, and I think you're so right because as much as the adjustment works and it is crucial, but what about the other 7 hours that day or the other 3 or 4 days before you go back for an adjustment. What you're
Right.
doing is yeah, so that education piece is incredibly helpful, and I think people will find, the way you've explained all of this so helpful and so interesting and take it into their daily practice because it's key. Because I know so many of us suffer neck and back pain, and it's directly from sitting at a computer a lot of the time. It really is.
It's an epidemic, I tell people,
Oh,
and
yeah.
so much, every single day, people coming in with very similar symptoms, and I almost know the answer before I ask, but I know that they are a desk worker because they
Yep,
all have very similar symptoms, and it's just the world that we live in. People
yeah,
are working on computers, and I don't think there's any way of getting away from that completely, that I've
fortunately.
been able to figure out. So
Yeah,
it really comes down to we just can't we can't let the screens take over our complete lives. We have to take some breaks throughout the day.
exactly, exactly. And on the other hand, and I we were starting to talk about this a little bit, preventive care, and seeking chiropractic care preventively and on a regular basis, which is so incredibly important. And what we continually stress here at YMyHealth is about preventive care. In chiropractic care, how does preventive care play out? And you were starting to talk a little bit about this.
Yeah. So what preventative care would look like in my office, you get the patient out of pain. Then
Mm,
you're working on overall, hey, let's get you exercising if you're not exercising, or let's find exercises that you like, um, and guide them. And then when we get to the point where they are on preventative care, it's a check-in. So it's like, if they come in once a month, how's everything going? Are you still able, are you still golfing? How's golf going? Everything's been feeling pretty good. But they almost always come in with some new thing that's giving them issues, and we're addressing it way before it gets to the point of no return where they're in extreme pain and they can't move. So it's so beneficial because again, we're able to address things much sooner and also give people advice and guidance on things that they just wouldn't ask or bring up if they weren't coming in on a regular basis. People always have questions for me about health and wellness. It could be something about their diet or, just even something small. Oh, this morning I was, walking outside and I just noticed this little twinge in the left side of my lower back. What do you think that could be? It's things that they wouldn't call and book an appointment for,
sure.
but since they are coming in as a checkup, then we're addressing it. And so they're getting much better care that way because we're able to stay on top of it. So I
Mm,
think that's a really big point. And those patients don't get injured nearly as much. They don't
interesting.
have those big big hot lower back episodes where they can't walk and they're having sciatica down their leg. It happens, but it happens at a much lower frequency.
That's really, really good to hear too and very helpful, and one of the things I know that a lot of us start to think about, I think, as you get, you know, into your 30s, 30, then 35, are, managing those age-related issues that we are starting to experience or we start to hear from our parents that they've experienced, like arthritis or degenerative, disc disease. How can chiropractic help with those? Because I know it would be key in that area, I would think.
Yeah, so those are 2 really big buzzwords. Arthritis, specifically, I'll talk about osteoarthritis.
Mhm,
That's the type of arthritis you get with age. So your
mhm,
joints start to develop bone spurs. Same thing with degenerative disc disease. I hear that word all the time, and
mhm.
primary cares use that word way, way too much with their patients. And I think it scares everybody because they
Oh,
think
yeah.
wrong with them. Degenerative disc and osteoarthritis are both conditions that are normal parts of aging and that all of us will develop at some point in our lives to some extent. Sometimes they can create problems, sometimes they don't. But it's like getting gray hair. We're all going to develop these things over time. Now, the benefit, again, back to chiropractic, is we can help you stay active and stay healthier so that you can minimize the amount of, degeneration you have in your body as a
Mhm.
whole. And a lot of that comes from your diet and exercise. So if your diet is in check and you're exercising regularly, you're getting good blood flow to the tissue, it's not going to degenerate as quickly. pro athletes have healthier joints than a couch potato. So,
Makes sense. Okay, great point.
and
Yeah.
a lot of people think it's the opposite. They think that if you've banged up your joints
Right.
by, being a professional athlete, you've used your joints so much that surely they're going to look far worse than someone who's sat on the couch. Their joints should look pristine, right? They haven't really used their joints. It's the exact opposite. A professional athlete, pending any severe injuries to their joints or anything that's really egregiously over the top usage wise, they've maintained a healthy program and so on and so forth, their joints will look better than someone who has not used their joints. So again, it comes down to let's educate, let's make people aware that if you want to keep healthy joints, then we need to use the joints. We need to be active with them. Uh, Spinal adjustments, extremity adjustments help to improve blood flow and keep the joints mobile so that you'll be able to use them more often and keep better range of motion, which will also promote, again, more movement in your daily lifestyle. And also just have better neurological feedback to your body as well.
Oh, absolutely fascinating. And you've heard it from Dr. Stanfill here. First, the preventative aspect, I mean, the advantages that you've mentioned are just unbelievable. I mean, it's so worth having that preventive mindset in chiropractic care and going for those maintenance visits because less injuries to your point. And also, I just think overall, when you're talking about with the neural pathways, just feeling better, physically feeling better, mentally feeling better, not being in pain. So, uh, really, really fascinating to hear all of that. And are there any cases I'm really curious of past patients who might want to highlight, obviously without identifying who they were, but just in your in your mind, who came in, they started out reactively for reactive care, ended up going into more of preventive and maintenance mode, and just the difference that you saw as a clinician and working with them coming from, "I'm here because I'm experiencing pain reactively," versus this person's on a maintenance, plan.
Instead of a specific case, I'll give you a situation that happens
Sure.
over and over and over again. And this
Okay.
is how it goes. So the husband or wife will come in first,
Mhm.
treatment for X, Y, or Z condition.
Mm.
And then it never fails by the third or fourth or visit, they're feeling so good that they bring their husband or wife in. So, but the husband or wife is a skeptic and they don't believe in chiropractors. They don't believe in what we do.
Mm.
So, but they're in so much pain. Their wife or husband
Mm.
dragged them into the office and said, "You're going to see him whether you like it or not, because you've been complaining about your lower back for the past 6 months, and just give it a shot and see what happens." Those patients end up becoming your biggest fans because they truly thought that what you were doing wasn't going to help.
Mhm.
And so they were reactive in the beginning
Yeah.
and you treat them for their condition. You get through a good portion of the treatment plan and all of a sudden their pain's gone that they've been having for a very chronic period of time.
Mm.
And now all of a sudden they're coming to you forever because they don't ever want to be in that position again. And they realize that it worked and it worked for them and it worked for their spouse. So, you've kind of proven yourself to them and that makes all the difference. And so that's how I would say, you can get these patients that aren't typical chiropractic patients come into your office that make you a little bit more nervous because you know that you're already like in the negatives with them. And then you're able to just show them through the treatment and through education that we can help them and prove it to them. Those ones always feel really good because you know that you've done a good job. They didn't want to do it.
Yeah.
Now they're happy to do it. And that they'll husband and wife coming together all the time. We get husband and wives. Parents will bring their kids in for preventative care for youth athletes all the time. So again, it always kind of starts with one, and the next thing you know, the whole family's in here. But it all started with one reactive patient. So they were coming in with a hot lower back or chronic headaches, and since you were able to get them relief, now
Mhm.
you built that trust with them. They're going to bring their whole family and all their friends to you, and some of those are usually preventative because they're not. in a ton of pain usually when someone tells them to come see you. So it all kind of translates over time.
Oh, I love hearing that, and it's so interesting, and it's that trust and that educational piece, but also, like, they trust that other, say, like your point with spouses, family member or spouse, and they're like, "Alright, I'll give it a try," and it must be so rewarding for you because you know you've made such a difference in these individuals' lives.
You
Yeah,
see how closed off they are when they walk in the door and like, I don't know about this," or maybe they're very nervous to get
sure.
adjusted. They think that they're gonna get hurt, and, then you go through the treatment with them, and you just see a complete change in their demeanor, and it's fun to watch. I enjoy it.
I bet, I bet. No, that's wonderful to hear, and I know far as the 50 and under crowd, the millennials, one of the things and I know even I'm sure the Gen X deal with this too, far as, something that's a common, uh, thing that we hear talked about in terms of diagnosis or a complaint with neck pain is the famous text neck, from text messaging on your phone, which so many people have, and I was wondering if you could kinda share a little history on the text neck part because some people that'll be a new term to them. I'm familiar with it myself. Um, and then how does preventive care kind of work? And you can also speak to reactive if you'd like as well, but play into helping our necks long term with this text neck because this is something that unfortunately a lot of people do because they're responding to text messages and they're not watching the way their neck is positioned.
Yeah. So text neck, I don't know when I heard text necks for the first time, but it's been a while, I
Yeah.
guess ever since people started texting, it's been around, but,
Yeah.
obviously that's not a diagnosis that I would give in the office is text neck,
How
but
to.
it does a good job of describing what's the mechanism for the
Mm,
injury in the first place, which is people are looking down. So text neck could apply to texting, but it could also apply to someone who's working at a computer all day because it's a very similar position.
yeah.
Texting, you're looking down a little bit more, of course, but what we're really talking about is a sedentary posture with the head tilted down. And so things that need to be addressed with text neck is you need to
Mm,
get your neck moving. You need to take breaks from your phone, obviously.
mm,
But what's really happening is you're looking down, which is putting stress on the suboccipital muscles at the base of your skull. Those muscles help you hold your head up. So if your head's down, those muscles have to activate to keep your head lifted up. And when those muscles get overused and aggravated, it starts to develop tension headaches. Tension headaches start at the base of the skull and they wrap around to the forehead. So if you're feeling headaches like that in a headband pattern, chances
mm.
are you've got, some text neck symptoms. Uh, that also plays into it'll start to develop into upper trap tightness and pain in between the shoulder blades. I hear this all day long.
Yep.
And then when it's gotten to a pretty significant point, they'll start to develop jaw pain. That's kind of the final form. So when people are telling me I've got headaches, mid back pain, trap pain, and my jaw's hurting, then I know that they've been dealing with this for a long time and they haven't addressed it. They're probably clenching at night. Their masseter muscles have gotten very tight. All this plays into text neck, again, is the nickname for it. What I would call it is like an upper cross syndrome. And
Mm,
all that does is describe a combination of tight muscles and weak muscles. So you got some muscles that are tight that are getting overused. And then you got some weak muscles like in the front of your neck that aren't getting used much because you're just looking down. So we want to start to address those asymmetries, strengthen some muscles, loosen up some tight ones. And
yeah.
obviously, the biggest thing is spend less time looking at your phone or a screen and getting up, moving around, get some fresh air, go for a walk. Doing that as much as you can throughout the day will really significantly reduce the amount of symptoms you're having.
I really, really appreciate that. And I know that's going to help so many people. And it's fascinating to think about as you're sharing with us all the different areas, because I think a lot of people will think about the neck overall, but won't realize what you're saying that it's a combination of weak and right, and tight muscles and all the different things involved. It's a reminder to not be looking down and taxing and definitely take breaks, as well. And clearly, chiropractic care holds so much value, for our health, just like you're saying with the neck alone, given our use of technology, which is not decreasing anytime soon. Unfortunately, I know. Are there any misconceptions about chiropractic care that you've heard in your career that you think act as barriers to people getting care and that you'd like to dispel while you're on the podcast?
How much time do you have? There's lots. Yeah, I think that the truth is, or the elephant in the room with chiropractors is, there's a lot of misconceptions, or chiropractors have always been looked down upon a little bit, I think, in traditional healthcare. Chiropractors aren't real doctors. You hear that sometimes,
Not true. Yeah.
or chiropractors will give you a stroke or kill you. That one gets thrown around a lot too. So, I think at the end of the day, chiropractors receive a lot of training, a ton of training. Not only do we go through undergraduate, just like any primary care would, but then we're also in chiropractic school for 3.5 to 5 years, depending on where you go to school, receiving tons of anatomy. I think a lot of people think, oh, chiropractic school, you're just like adjusting people. That's all you're learning how to do. So much more than that. We're learning how to diagnose. We're learning about every system in the body, how to do exams on every system in the body. We know how to do heart exams, lung exams, eye exams. We learn all of that too. Um, and so I just want people to understand we're very thorough with what we do in our training. And the number one thing that, or the last thing we would ever want to do would be to harm a patient. We would never, ever, ever want anyone to harm anyone. Our oath is to help people and do good for our patients. So we receive a ton of training in order to make sure that we avoid anything that could ever injure or harm a patient, make sure that we're only adjusting people that it is safe to adjust, and only recommend things for patients that are safe, and highly recommend them. And the other hot button topic that I mentioned is the stroke thing. A lot of
Yeah.
chiropractors hate to get into this one because it is a hairy topic. There's a lot of studies that have been done over the years to try to determine whether or not chiropractors are causing strokes with neck adjustments or not.
Mhm.
There is no clear evidence that I have been shown that chiropractors are causing strokes on patients by adjusting their necks. But I will say, a lot of the times, what we talk about in school is that patients can be having stroke symptoms when they
Mm,
visit the chiropractor. And if that chiropractor is negligent by not catching those symptoms and adjusting that patient, you do have a lot of responsibility on your shoulders for the well being of that patient. Meaning, if they were having a stroke and you didn't realize it,
mm.
that's a really bad look. And that's why it's so important that you do a proper history and exam with your patients to make sure that if someone is having any type of emergent situation, you're able to recognize that, because strokes, heart attacks can represent with neck and arm pain, things that people would also go to see a chiropractor for. So I think sometimes that gets misconstrued, and things that they may think, I just need an adjustment, when in actuality they could be having that stroke or heart attack where they do need to go to the emergency room and get medical assistance immediately for. Sometimes that's where some of the confusion arises. And yeah, I think that's the big thing that people should understand is, as long as your chiropractor is doing a really good job of looking you over, the risk is very, very minimal that anything will go wrong. Doesn't mean that it can't. I
Sure.
always tell people there's risk with everything that you do. Surgery poses a very high risk in a lot of situations. So,
Yeah.
you're usually better off starting with something more conservative: chiropractic, physical therapy, acupuncture, massage, really anything. Your chance of injury is much, much lower with conservative care, whatever it may be, as opposed to going the surgical or the medicine route. And that has a time and a place too. I'm not a purist on anything, but it's try to start with conservative first, and then, you know, move your way up the chain as you need to.
Oh, 100%, and I think so many of us are looking for that conservative path. in the younger age group, and that is to your point about strokes and chiropractic. Has always, I think, for a long time been a hot button topic, and I really appreciate you uh, bringing that to light and, getting into detail on that. I think that's gonna be helpful for a lot of people, as to how in that way that it's just really timing and for those who have not, in terms of timely diagnosis there, done that. And then also in terms of your training, you really do have very extensive training. So I appreciate you bringing that up as well. And when it comes to us aging gracefully, which is the plan, aging gracefully and avoiding aches and pains that we hear our parents have experienced, how can chiropractic care help us with that? And how does it fit into this picture of holistic wellness that so many of us are trying to achieve?
Movement is going to be your best friend. So movement is medicine. I can't stress that enough. If you're not moving your body, you're going to go downhill. Your body's going to start to degrade and break down, and diet as well. So I sound like a broken record a lot of the time talking about these things, but it is the most important thing you can do. It will save you so much money in healthcare costs
Mm.
as you age if you spend your time wisely. So, I've heard all the arguments, or I don't have time to exercise, or I can't afford to eat healthy. You have to. You really need to, because it will cost you down the road one way or another. And you can either put in the time and the work now, or you'll pay for it later. Recommendations on diet is like a Mediterranean style diet or an anti-inflammatory diet. So avoid things in a box, a can, or a bag. Definitely avoid added sugars at all costs. Try to eat whole foods. It's really that simple. That doesn't mean you can't go out to eat and have a good time with your friends, have a drink here and there, live life a little bit, but it can't be your lifestyle. It's got to be based around a healthy a healthy core. And so if you can get your diet in check and you can get, an hour of movement every day, you'll be 99% better off than anyone else in your age range. That's the number one thing I can recommend. I'll also highly recommend getting adjusted, of course,
Yes.
because all of these things I'm saying, you will need reminders and guidance on. And, that's what a healthcare provider should be for, right? Is to help guide you down these roads. And when you have questions, help answer those questions for you. And make sure that when you start to develop tightness or restrictions through your spine, your extremities, through your musculature, your fascia, that those things are being addressed and that we're taking care of those things at an appropriate time frame.
Oh, absolutely. And just outstanding advice, outstanding recommendations for all of us. We really appreciate that. And as we wrap up today's episode, if somebody is in your area, in the Missouri area, they can definitely come see you. But for those who live in other parts of the country and can't come regularly, and I know you said you have had people come in from around the country and world. Um, just for those who are not able to in person, really curious about what your recommendations would be, for what to look for and ask about when seeking out chiropractic care.
When you seek out a chiropractor, I would recommend going to a chiropractor that doesn't x-ray every single patient. So, and the reason why I say that is if your chiropractor is x-raying every single patient that walks through the door, they're probably doing it for the wrong reasons, like spinal symmetry, or,
Mhm.
looking at the curvature of your spine and saying that
Got
we're going to correct the alignment, because we found in more recent research that that's not what's happening. We're working mobility of the joints, but we're not necessarily moving the joints back into place. So if they're x-raying everybody, it's kind of, they're already built on a bad premise. And so I would recommend not necessarily going that direction. X-ray has a time and a place 100%, but there needs to be some red flags indicated first. And let's not expose our patients to unnecessary radiation. That would be one thing I recommend. Another thing is avoid big treatment packages. So if a chiropractor tries to sign you up on a $3,000 to a $5,000 package on your first visit, I would probably avoid that as well. So if you come in on the first day
Mhm.
and they don't adjust you and they tell you you have to come back for a second day, that's usually also a red flag because they want you to come back and get invested and spend more time in the office so that you're more likely to sign up on a big treatment package. So that one might get me killed, but
No, for millennials who are trying to budget costs and still take care of their health, that's very helpful.
yeah,
So
so I would just say those are some little like sales things that they will do to
yeah,
watch out for. If it's pay per visit, that's good. That's how we do things at our office. You know, don't let them over recommend things to you is another thing too. So just, you know, yeah, it's somewhat hard to recommend because every chiropractor can be so different, like I was telling you in the beginning.
yeah.
That it's just like anything else though. Every profession you have your good and your bad out there. Read reviews, look through Google reviews a lot and see what other people say. Look through their website, see where they went to school. Just do your research before you trust them, just like you would a surgeon or a primary care. You'd look them up and read about them a little bit first before you decided to go see them for the first time.
Great tips, and we really appreciate your candor on this, because you've been out in the field, you've seen, you know how you run your practice and your approach. You've seen how others do at this point, and so it's really helpful to hear that information from you as we're looking. And how can people connect with you? And is there anything uh, you would like to plug while we're on the podcast?
Yeah, it's really easy. It's just Dr. Holden Stanfill on everything. So YouTube, TikTok, Instagram, Facebook, Snapchat, X, we do it all. And then I do virtual consults too. So if you
Oh,
do have questions, again, all of these things that we've talked about today, recommendations on diet, exercise, or needing help finding a chiropractor, whatever it may need be, we do offer virtual consultations where you can ask me whatever you need to ask me. I have people do virtual consults with me for um, not that I'm by any means a mental therapist, but more for mental clarity, I would say. So working on meditation, and just better sleep habits, diet, again, a more holistic mindset, but they like to get their mental in check as well and make sure that they're, kind of clearly addressing their health in all ways possible. So a lot of people do virtual consults with me too before coming traveling to St. Louis, just to make sure that it's the right fit and that there's a high chance that I would be able to adjust them. Sometimes people have had surgeries that they're nervous about. They want to talk to me about it before, and or maybe they have some different health conditions that they just want to make me aware of and make sure that it is still safe to adjust them before they come. So that's been a pretty popular service for out of towners before they make the commitment. So we offer that too.
that's awesome. No, well, we'll definitely put a link in the show notes so that people can do that. And when you were mentioning about sleep, I know amongst other things, that would definitely be helpful for a consult for many to talk with you and know that that option is there virtually is wonderful since we have listeners from all over. So I appreciate that. Well, thank you so much, Dr. Stanfield, for spending so much time with us today, for sharing all of your amazing experience and insights on your journey from the beginning of going into chiropractic care and your wonderful practice that you have now and just all of the things that you've learned all these years and what you've seen. We really appreciate it to help us optimize our health because that's the goal.
Of course, not a problem, Melissa.
Well, thank you.